Did you know that how you take care of your mouth, including brushing, flossing, and getting regular checkups and cleanings, directly impacts your heart health? Now, this is my jam, and I'm excited to be here today to talk to you about this particular subject matter because more than half of the U.S. adults don't even know that heart disease is the leading cause of death despite a 100-year reign. I'm Dr. Jill Wade, and I want to welcome you to the Beyond Face Value show. Let me introduce you to my wonderful guest co-host today, Laura Lewis Edwards, our health and beauty expert.
Hey, Dr. Jill, exciting. This is good stuff today.
I am excited about this today because honestly, I love designing new smiles at the office. I really do. I love teeth. I think they're great. But man, when I started practicing this way and saving lives, like it was a game changer for me because I wasn't then just drilling on teeth. I was really feeling the impact of what I was educating people about and what we were doing for them in the office was really changing the outcome of their overall health and well-being. It was incredible.
And what you're referring to is the practice of practicing wellness-oriented dentistry or wellness dentistry, right?
Yes.
Where you're looking holistically at your patients, which I so admire about what you do and your passion around this. And this is a really, really important topic today that has impacted so many lives and continues to do so every single day, likely every single hour, every single minute.
Absolutely. I literally want to jump on the rooftops all the time and just shout this out to everybody because oddly enough, it's still very not understood or even discussed and talked about. Like I said, I'm personally very passionate about this topic, and I've devoted a large amount of time in our dental practice to focus on what we call dental wellness. We even created a program called the Smile with Heart program specifically for this, and we co-manage patients together with all kinds of physicians, functional medicine doctors, cardiologists, because like I said, I didn't say this, but the medical community certainly understands heart disease, but they don't understand anything about dentistry. They spent just a couple of hours in their training on dentistry. And in dentistry, yes, we learned a skill and we know how to do dentistry, but we did actually study much more about medicine, and we go over medical history. We see our patients more often than physicians do. We have great relationships with them. We take blood pressure every time they come into the practice. So we really are able in a trusted way to really influence people's decisions and, lifestyle changes and things like that. But let's talk just a little bit, Laura, because I know this subject matter may also be near and dear to your heart as well.
Yes, definitely near my heart for sure, because it was my family. And my father had his first heart attack, which he survived at the age of 40. Wow. He was in a very high-stress job. He had some bad habits. He did survive, as I said, but then he continued to have heart issues throughout his life, and he finally left this world when he was 78 years old due to heart issues. And my brother, who was younger than me, he had his first triple bypass when he was 37, and that he had passed away. He's passed away 3 years ago due to heart issues. And I have to say, by the way, genetically, when all this was going on, I was told to go to a cardiologist. And I had always, I have a degree in nutrition. I'm a fitness gal. I love everything health. But, they're like, you need to go get checked just to make sure there's nothing. And so I was checked out, and, the doctor said, get off the treadmill. You're great. Go and keep doing what you're doing. But, to have our lives, my mother's life, our family's lives have been impacted by the loss of my father. And he had a very stressful job. I know it had a lot to do with it. But it also makes me think, because of our topic today, both my father and my brother, about the oral health connection to heart and heart disease.
And that's what people don't know. There's kind of a weird word that gets talked about slightly, but I don't think people really understand what it means. It's called the oral systemic link. And people just roll that right off their tongue, the oral systemic link, and then they just kind of move on. And people don't really understand what they mean by that. But what we mean by that is literally that the mouth is so vascular. So it has so much direct influence on our arterial health that is the link that makes the oral systemic link happen. And so today we're obviously going to talk about cardiovascular disease, but we also have a ton of research that shows it's also about our brain health, diabetes, so many things that today we're limiting to cardiovascular disease talk.
Yes.
But later in other episodes, we will talk more about different oral systemic links, I am sure. So Laura, I want to share with you quickly a few staggering new statistics from the American Heart Association.
Okay.
Get ready for this.
All right.
It's crazy. Did you know that approximately every 40 seconds, someone in the U.S. will have a heart attack, and every 34 seconds, someone dies from cardiovascular disease?
Shocking.
It is.
It is shocking.
Think about that. Even just in the short period of time that we're going to have this show, how many people are going to be affected? And not just the patient itself that it's happening to, but just like you said, the family,
Right.
the wife. Oh, sorry, I got goosebumps. The family, the kids. It's devastating to families. Heart disease and strokes claimed more lives in 2021 than all cancers combined.
It is
All cancers
staggering.
combined.
Staggering.
And between 2019 and 2020, direct and indirect cost of cardiovascular disease were $422 billion. Billion dollars.
Big industry.
It's a big industry. I would like to personally
Decrease.
do what
that.
I can do to decrease that.
Yeah.
And to keep families from being devastated by this. We'll talk a little bit more about the cost, the investment of doing some of these things in dentistry to help you not have the cost of these just devastating bills that come with having a heart attack.
Right. And if you think about it, I mean, and you will dig into this, I'm sure, but even having to go through the emotional aspect of it, the physical aspect of it, and then we have to put the financial on top of it, which is the reality of it all. So I can't wait to hear more about what you have to say about how we can help bring that number down.
Absolutely. Well, so a lot of people ask me, how does your oral health actually impact your heart health and the health of the rest of your body? And until years ago, this connection, like I said, wasn't really understood or considered. But it really, I'm going to just try to boil it down into just two simple concepts.
Okay, two.
Okay, two.
All right.
When you come to the dentist, we're basically going to help diagnose two things. One is called periodontal disease. And periodontal disease you hear it on commercials all the time, gingivitis, periodontal disease. You may have had a grandparent that called it trench mouth. I mean, there is a lot of names out there in the public that is used. But periodontal disease is the bacteria that can live around our teeth. And we're not sterile, so we always do have bacteria in our mouth.
There's good
and bad. Exactly. So we're talking about the bad bacteria that is so aggressive that it does not like oxygen. And so what does it do? If it doesn't like oxygen, because we breathe through our mouth, it will dive deep down into the pockets and live down low. And it will deteriorate the bone, and it will create a ton of inflammation, redness, swelling, bleeding. So this is why some of these things are so important as cues in the mouth if you are brushing and flossing and bleeding, okay? This means those pockets down deep are not healthy. So that's why if we're seeing some, little subtle signs in the sink when you're spitting out after you brushed and bleeding, these are, cues that I want people to start thinking about that, hey, if I haven't been to the dentist in a while, I need to get back into the dentist. But when periodontal disease gets down deep in there, guess what's all around it? It's all vascular. The mouth is extremely vascular.
So lots of blood vessels going to the rest of the body.
Exactly.
I mean, it's all connected.
It's a direct opening.
Right.
Okay. So imagine that you have a wound on your knee. You scratched it. It's a big wound. And, it's the size of, let's say, an orange.
Okay.
Okay. And you go to the hospital to have the wound cleaned, right?
Yeah.
So would you clean just half of the wound, or would you clean all of the wound?
All of it, of course.
All of it, of course. So when we're trying to treat periodontal disease, I believe that you need to treat the whole mouth at the same time, meaning the deeper cleanings. Some people call them deep cleanings. We actually call it scaling and root planing, which means we're going underneath the gum to basically bring up and out, disrupt the colony of the bacteria that's down in the pockets.
And you said that really fast. Scaling and what?
Root planing.
Scaling and root planing. Got it.
That's
okay.
the real term, but most people call it a deep
Deep
cleaning.
cleaning. Okay.
And we want to really kind of attack, if that makes sense. We want to attack the whole mouth at the same time. And many a times we will use some salivary testing so that we know exactly what bacteria is doing the damage.
Because it's different for everybody.
Because it's different for everybody. It's kind of like a thumbprint, okay? But when we know exactly which bacteria we're dealing with, the bad guys, then we can put you on a round of specific antibiotics, depending on what you need, 7 to 10 days, to actually get inside the systemic aspect of you, your whole body, throughout your whole arterial, miles and miles of arterial vessels. And then we can tamper down that amount of bacteria, which is causing so much inflammation. And the science and the research shows that that same bacteria is what is creating the inflammation in our arteries and is creating them to be, depending on how long it's gone on, so fragile that it then becomes an event, a heart attack, a stroke, or an aneurysm.
Yeah.
So what people don't understand is that the mouth or periodontal disease can be some of the first reasons why the bacteria actually gets into the artery system in the first place.
Right.
And is creating everything to be on fire or inflamed.
I mean, if you really think about it, so if we were raised as kids in families with our dentists that were talking to us about this topic very young, we would be thinking differently. Everybody would be thinking differently about their overall health, understanding that this is really the portal. This is the most important place that really needs to keep healthy, not just to have a pretty, healthy smile, not just to have a few cavities, not just addressing gum disease isolated from the rest of your body. I mean, it just makes such perfect sense about this. And it's thought provoking.
It is.
As I shared with you, even talking about the story about my father and my brother, I'm wondering, of course, this is after the fact. I think a lot of people can identify with that if someone has passed away in their lives due to some sort of illness, that they go back and they go, well, what could we have done differently? What could have happened? Could they have lived a longer, higher quality of life?
Right. Absolutely. I think people, and I know people that they come to me and maybe they've had an event, and that's exactly what they're asking. And that's exactly why they end up in our office.
Right.
Obviously, people live all over the country, and so we've got to be able to let the public understand just the simple basic aspect of going to get your teeth cleaned on a regular basis is very critical. That 6-month interval or 3 or 4-month interval that they're asking you to do is not because they want more money from you. It's because the science shows that if we can go in and disrupt the colony of the bacteria in the deeper parts of the pocket every 90 days, that colony can't form as big, and the amount, like literally the volume of the amount of the bacteria can't get into the bloodstream quite as much, and therefore you're not as inflamed. So people don't understand that. And I think over the years, commercials and different dentistry things have done a great job of saying you need to brush your teeth 2 times a day, you need to floss, you bleeding is bad. But at the same time, I feel like we didn't do a good job saying the why.
Yes.
We just are saying it, but we're not explaining the why. And I think that's what you were trying to say a few minutes ago. If we really started to educate our kids and our adults early on that you do that to protect your heart,
Yes.
then I actually think, man, people would be more understanding and more motivated to do the things at home they need to do, to get to a professional on a consistent basis.
Flossing their teeth.
Flossing their teeth.
Brushing their teeth often, seeing a hygienist, getting their teeth cleaned, seeing their dentist. Okay?
Absolutely.
Right. And I had this, I'm very visual, and I had this image of, those little bad guys, like little invaders, and they're just diving into your bloodstream and going and wreaking havoc.
They are.
And in this case, we're talking about heart health.
Yeah, we are.
Yeah. And wow.
Yeah.
Stop them from going to the rest of the body.
Yes. So number 2. So that was my number 1 thing.
Okay.
Easily done in the dental office. This is not something that you're going to get treated or diagnosed in any medical office or cardiology office. Trust me.
Okay.
Not going to get diagnosed there. Right. Only in the dental office you're going to get diagnosed with periodontal disease. So the second thing, when somebody comes to our office and is in our Smile with Heart program, the other thing that we do is take a lot of diagnostics, diagnostic x-rays, both 2-dimensional and 3-dimensional. So that's called cone beam technology. And what we are searching for are undiagnosed dental infections, true infections of the tooth itself due to a large cavity, something that's broken, whatever it is that got the bacteria inside the tooth itself, and the tooth has decided to die and create an infection in the bone.
And I have a question about that. How many people do you see as patients with that type of thing that don't know they have an infection?
Quite a few. And I'll tell you why. Sometimes teeth that are not vital, that do have an infection, maybe hurt a long time ago. And maybe you had some other health issues going on, or maybe you thought it was just a migraine period of time and you just blamed it on a migraine. But in actuality, the tooth was dying and you never got it pinpointed to an actual tooth itself. But then after it has died, then sometimes the intense pain goes away.
Because the nerve died.
Because the nerves died.
Got it.
Correct. And some people can have had root canals or things like that. So the tooth doesn't actually have feeling anymore. But every once in a while, they will have a secondary infection on a tooth that's already had a root canal, and it doesn't really hurt. It just feels strange, but it does not hurt. And these are the ones, and these are the teeth that we hone into because we understand the science and we understand the medical and the blood work side of things, where we can hone in and decide, is that a scar or is that a secondary infection?
And you could have the infection and not know it and feeling bad and you don't know why, like fluish or viral or tired or something. And it's sort of this mystery. Maybe they've already gone to the doctor. The doctor's like, well, I can't find anything wrong. And then here, lo and behold, this might be this underlying infection that they can't feel, but you can see with that fabulous cone beam technology, right? And other x-rays.
So imagine, let's just take it one step further. Imagine that somebody has not only periodontal disease, but they also have a dental infection. They're getting double whammy, right? So they have a true low-grade infection that is there 100% of the time. This is why I think, this is my theory, can't prove it, but this is why I think during COVID, when people couldn't get it out, they couldn't get to the dentist as much, a lot of stress happening for lots of different reasons. We had a resurge of periodontal disease. We had a resurge of infections and tooth loss for the year afterwards. And we have so many cardiovascular incidents since COVID and during COVID. It's not exactly. It's a full circle.
Right.
It's not a coincidence.
Right.
So we've already kind of talked about the impact that it has on families when somebody's gone through an event and just how devastating it can be, not only from an emotional standpoint, but from a financial standpoint as well. How many people have to file personal bankruptcy after having a heart attack? The numbers are staggering, absolutely staggering. And this is why. There was an article written back in 2010. So the numbers that I'm going to share with you, I actually think are worse now than even in 2010. The National Business Group on Health reported back then that the average heart attack, including both direct cost and indirect cost, is about $1 million for a family.
$1 million.
On a family is such a stressful financial burden that many people will have to file personal bankruptcy. And if you look at the number one reason why people file personal bankruptcy, the number one reason is hospital and financial
Medical bills.
medical bills.
My gosh.
Yeah.
And see, it doesn't seem fair. It doesn't seem right because of everything else you've gone through.
Right.
And I know, again, people that are listening or watching will identify with this too, or have heard of these stories from friends or family members. And so really we're kind of circling back to this whole source of oral health, trying to make sure that we're as healthy as possible so we don't get to that point.
Absolutely. And the cost, or let's say the investment in your mouth, in your gum health, taking care of teeth that maybe need to be removed or dealt with that are infected is so much less costly than the alternative.
Right. So if you do the math about that, like the cleanings every 3 to 6 months, depending upon, you were mentioning even.
You can get a lot of dentistry for $1 million. I'm just saying.
That's a lot. Like how many smile makeovers or, it's tiny compared to that number.
Mm-hmm. And then, like you said, with a genetical tendency, you need to take the whole family. This is not just the one person that maybe has cardiovascular disease. This needs to be the whole entire family. And you need to start when you're young, and you need to educate, and it needs to become an amazing habit.
Yes, exactly. So I can think about the language that you might use with your toddler now about let's go ahead and get those little guys, so keep you healthy and strong. Yeah.
Because, don't get me wrong. I'm a dentist. I love teeth. I love taking care of people's 32 teeth. I do. Mm-hmm. But it's more important that we protect our one and only heart. We only have one. We don't get another one. We can't put a, dental implant in there on a tooth. And so it's just, we have to do whatever is necessary to protect our heart health.
Yes.
And I think a very important piece of that, obviously, is the oral cavity.
Oral cavity, teeth, gums, the whole shebang.
The whole shebang.
Right.
I do want to leave you guys, though, with one very positive point that most people do not know, and that is that heart disease is reversible. Did you know that? It's reversible.
Yes, I did know that.
Now, most people aren't willing to do the really tough lifestyle changes that have to happen. But I know on more episodes we're going to be talking about what it takes those lifestyle changes to make a difference.
Right. And I will share one little story with you. When I was getting my degree in nutrition, I just shared this the other day with my husband. And I had to do a little tiny internship at a small hospital. And one of my jobs was to go into the rooms with people who, had a heart attack. And I did go visit a gentleman. I walked in. I'm just, I don't know, I was like 20. And I walked in and he was very friendly to me. And, well, young lady, what can you do? Well, I understand, sir, that you had a heart attack. And what we're going to talk about today is we're going to talk about the food that you're eating. Now, can you please tell me what you have for breakfast typically? And his answer was eggs, sausage, biscuits, gravy. And I mistakenly said, well, sir, you're going to have to stop having biscuits and gravy and eggs, and you're going to have to change your breakfast. And he started yelling at me and said, get out of the room. I don't want to talk to you, whatever. And it was at that point that I said to myself, I think I want to work with people that want to live a long life, that want to be healthy, that really have a desire to do what it takes. Now, it's not fair because he'd only been like a week or something. And I hope that he got to a point where he knew, just by making a small change even in that way, that's a lifestyle change. Right. But just like what you're talking about, do you have it within you to make some of these lifestyle changes so you have a higher quality of life and you are going to enjoy life longer, your family and friends are going to enjoy you longer, and the quality of your life is going to be better.
So true.
Yeah. I'm in. I'm a champion for what you're talking about.
I'm telling you, I think we all should be, right?
Yeah.
So this concludes our episode of Oral Health and Your Heart on the Living Beyond Face Value podcast. Thank you, Laura, for being our guest host today. It's been a ton of fun. Thank you for sharing your personal stories.
Oh, you're so welcome.
It
Thanks
is
for
important that we share these things because it does affect more than just the person.
Well, thank you again for having me. I'm honored to be here.
I wanted to also thank you, our viewers and listeners, for being a part of our podcast today. It's my hope that in some way, what we shared today has improved your life or even saved a life of someone that you love. Also, to help us grow and expand our reach, be sure to like and subscribe to this show on YouTube or your favorite podcast platforms such as Spotify, Apple Podcasts, or whatever you prefer. Just remember, it's time to live your legacy now. I'm Dr. Jill Wade, and this has been the Beyond Face Value Show. Until next time.